A 14-day notice by the Kenya Medical Practitioners, Pharmacists and Dentists Union that would see doctors paralyze operations in health institutions, compelling the government to address their plight. In a country where public hospitals are reportedly run by about 3,000 doctors against a required number of 40,000, while about 10,000 nurses remain unemployed, even as the medical sector needs in excess of 40,000 nurses. The gravity of the matter, one that saw the union issue an ultimatum to the government Saturday that would see the list paid newly graduate doctor earn 124,000 Kenya shillings, up from the current 31,000 Kenya shillings, a 300% increase.
Is because the last time the doctors had a salary review was in 1994, which is more than, it's almost going to be 20 years. It's like 16 years ago.
Medical Services Minister Professor Anyang Nyong'o taking up the union's offer to give negotiations a chance Monday evening in what was a closed-door 2-hour negotiation. And the outcome?
What I told the union is that no negotiation has broken down. Strike is usually held when negotiations break down, as it were. I think they said that they will hold a strike, but since we have opened up avenues for discussions, I don't see that the strike should be an issue now.
As far as the December 5th industrial action by doctors is concerned, it is still stands, and the fate of that industrial action will depend on how the negotiations will go. It will depend on the urgency of the negotiations, and it will depend on the implementation timetable.
The headline position of the union has also seen them demand an increase in medical and risk allowances and employment of more doctors, as well as an improvement of hospital facilities.
Doctors are at risk all the time. We are coughed at. The patients bleed on us. We are patients who are violent. The patients who are confused. So we don't, in the current scheme of service, we do not get any risk allowance. We need an extraneous allowance. An extraneous allowance is an allowance. Such an example I can give you is you go in for you go into surgery. You thought the surgery is going to take 1 hour, 2 hours. It was possibly a basic surgery. What you go in and you find that you're going to be there for 6 to 8 hours. This is what I'm calling extraneous allowance.
Agreed, therefore, that we are forming a team to look into this, composed of officials from this ministry and officials from the Doctors Union, the Kenya Medical Practitioners, Pharmacists and Dentists Union. I'm going to get this team to begin meeting us for tomorrow so that these issues can be looked at in detail and we can come up with a plan of action, because a lot will depend on Treasury resources.
If the doctors make good their threat to proceed with the 5th December strike, if the negotiations don't bear fruit, then thousands of lives are likely to be in danger. Medical Services Minister Professor Anyang Nyong'o, however, remains confident that the ongoing negotiations will resolve the current stalemate. Mbilu, Citizen, live at 9.